So I'll pass it to you, Vice Chair.
Thank you, Amari. Good evening. My name is Karen Boykin-Towns, and I have the privilege of serving as Vice Chair of the NAACP National Board of Directors. And it's a privilege to welcome each of you to this critical conversation about our bodies, our votes, defending reproductive justice. Now, this issue isn't just a women's issue, but as the highest ranking woman in the NAACP and the mother of 2 adult daughters, this issue is very personal to me. We've seen the attacks on Roe v. Wade, the shifting balance of power on the Supreme Court, and the threat of Project 2025. We are all too aware that reproductive health care faces unprecedented threats across this country. And it's more critical now than ever before that we stand united in our efforts to protect and expand these rights. We are only 27 days until Election Day, with early voting starting as soon as October 15th in Georgia and October 17th in North Carolina. The intersection of reproductive justice, racial equity, and healthcare access is undeniable, and for Black and marginalized communities, the stakes couldn't be higher. This evening, I am thrilled that we are joined by some of the most dynamic thought leaders, advocates, and organizers who are at the forefront of the fight to safeguard our rights. Together, we will explore the most pressing legislative challenges, how they impact our communities, and what we can do to drive meaningful change. Now, our forever First Lady, Michelle Obama, told us all to do something. So National Voter Education Week is more than just a name, it's an action. We will utilize this session to highlight the critical role voter education plays in securing the future of reproductive rights. Voting is critically important, but it's not just about voting. It's about ensuring that every individual is equipped with the knowledge and tools they need to make informed decisions at the polls, decisions that shape the future of reproductive justice for generations to come. And this conversation is just the beginning. By raising awareness, mobilizing our communities, and channeling our collective power, we can ensure that reproductive health care remains a fundamental right for my daughters and for all of us. So let's get started.
Thank you so much, Vice Chair. We are awaiting one special guest, and she has just joined us. And I thank you so much for joining us. We have none other than Ms. Kelley Robinson from the Human Rights Campaign. Kelley, do you mind coming on camera and also giving remarks?
Yes. Oh, I'm happy to be special and a guest. Thank you so much for having me, y'all. I don't know if you can see me. I'm in the car right now. Hey, there we go. Hey, y'all, I'm in these streets getting ready for this election, just like I know so many of you are. So thanks for bearing with me as I'm in the car today. I'm Kelley Robinson. I use she, her pronouns. I'm proud to serve as president of the Human Rights Campaign. I'm proud to be on this call. Huge thank you to the NAACP for bringing us together, and a special thank you to President Derek Johnson for your leadership and inspiration to us all. Look, I got to tell you, reproductive rights are under attack, and that means all of our rights are under attack. I served at Planned Parenthood for almost 13 years before coming to the Human Rights Campaign, and the thing that shook me to my core was when Roe v. Wade was overturned and Clarence Thomas in his concurrence said the quiet part out loud. The next, he encouraged the courts to come for Obergefell and Windsor and Lawrence, court cases that have defined our rights as LGBTQ plus people in this country for over a decade. So we have to be clear in this moment that when reproductive rights are under attack, all of our rights are under attack. Our freedom to live and love as we choose is under attack. But here's what I also know. We are not backing down, and we sure as hell are not going back. When they come for reproductive rights, they are coming for all of us. When they target LGBTQ plus folks, they are targeting everyone who believes in freedom. This isn't just about one issue. It's about our fundamental right to control our own bodies and our own lives. Reproductive justice is for all of us. It's for lesbians and trans folks and non-binary folks. It's everybody's issue. So I'm excited because I think that the level of threats that we've seen from the Supreme Court to Project 2025 to candidates to extremists across the country shows that they are afraid of our power. And when we come together this election, not if, but when, we are going to show them that we are more powerful than all the attacks they could wage against us. This election is 26 days away, my friends, 26 days. And I keep saying November 5th is the last day of the election. It's not the first. We got to do everything that we can, every day that we can, to show the will and the power of our people in the face of all this extremism. So y'all know this is National Voter Education Week. Knowledge is power. When we understand what's at stake, when we know our rights, when we show up informed and ready to act, that's when we are unstoppable. So I'm calling on each and every one of you, because when we stand together, Black and white and brown, gay and straight, trans and non-binary, when we recognize that our struggles are connected and our destinies are intertwined, that's when we become a force that cannot be stopped. Y'all, the future is in our hands. They are fighting a future that has already arrived. And I'm excited to manifest that over the next 26 days. So the Human Rights Campaign is in it with you. I'm in it with you. Let's go. Let's do the work. Let's win this and let's get free, y'all. Thank you so much for having me tonight.
Thank you so much, Kelley. We appreciate it. You have us fired up and prepared for this conversation. Thank you so much for joining us. Now we can go ahead and deep dive into our conversation. Without further ado, I actually have the extreme pleasure of also introducing our moderator, Dr. Wendy Osefo. She is an award-winning researcher and a Nigerian-American television personality, an author, and a political commentator. We are so thankful to have her with us this evening. I will go ahead and pass it to you.
Thank you so much for having me this evening. I am completely fired up, and in the words of, our last real, amazing president, I'm fired up and ready to go. I know that there are only 26 days until this election, and there are so many important things that we need to discuss, and one of those are reproductive rights. I want all of us to level set a little bit before we dive into the conversation and talk about what exactly is the nexus of this event and why are we here today. As reproductive healthcare faces unprecedented threats across the country, this particular session will focus on how we as individuals can actually protect and expand these rights through civic engagement and community mobilization. With the 2024 election quickly approaching 26 days, we will keep on saying that through the course of this conversation for us to really crystallize why this is so important. It is more critical than ever to understand how reproductive justice intersects with racial, economic, and healthcare access, and how we can use our collective power to drive meaningful change. So to that end, we have brought together thought leaders, advocates, and organizers, and this session will delve into the most urgent legislative threats to reproductive rights and what's at stake for Black and marginalized communities, because we know that whenever anything happens, it's usually Black people who are at the bottom of those percentage points. During National Voter Education Week, this session will also highlight the vital role of voter education in shaping the future of reproductive justice and ensuring that communities are empowered with the knowledge and tools they need to make informed decisions at the polls. We want you guys to walk away from this session feeling more informed than ever and knowing exactly why reproductive justice not only impacts us, but impacts all of us collectively as a community. So without further ado, I want to, introduce our esteemed panelists for this evening. We have Ashanti Gholar, who is the president of Emerge. We have Dr. Chris Pernell, who is the director for the Center for Health Equity, NAACP. We have Jacqueline Ayers, who's the Senior Vice President of Policy, Campaigns, and Advocacy at Planned Parenthood. And we have Ashanta Gleason, who's the Region 6 National Youth Board member for NAACP. And I feel as though these individuals have done such amazing work. I don't want to truncate their bios by any means. So I will let each of them let you know more about them and introduce themselves. And I would like to first pass the mic, so to speak, to Ashanti.
Hello, everyone. Hello, Dr. Wendy. So good to see you. I'm Ashanti Gholar. I am the president of Emerge. I am honored and privileged to be the first Black woman to lead this network, and we love having the NAACP as partners. And this is a very exciting time for us. We recruit and train women to run for office at all levels across the country, and our organization actually came out of the vice president's very first race for DA. So she is the original Emerge woman, or the OG of Emerge, as we like to say. So we were built for this moment, and I'm really excited to be in community with my sisters here for this very important conversation.
Thank you so much, Ashanti. Dr. Chris Pernell?
Thank you, Dr. Wendy. A hearty good evening to everyone. I got to shout out East Orange, New Jersey, my hometown. I saw that EO love. I am Dr. Chris. I lead our Center for Health Equity at the NAACP. I am a public health and preventive medicine physician by training. What does that mean? It means I am the type of physician that looks at systems, looks at policies, practices, is deep in community, and looks to understand those determinants that influence, shape, and determine health outcomes. And as lead of the center, we are knee deep, heart deep, soul deep in all issues that are foundational to the health and well-being of the Black community and of all historically excluded groups. And we have been sounding the alarm around the encroachment on reproductive justice and other limitations on healthcare access. So happy to be able to lean into this conversation tonight with such esteemed persons around the table. Thank you.
Thank you so much. Jacqueline Ayers?
Hello, good evening. Thank you so much to the NAACP for hosting this event. My name is Jacqueline Ayers. I'm the Senior Vice President for Policy and Campaigns at Planned Parenthood Federation of America. I'm really delighted that this conversation is happening tonight because never more since the fall of Roe has the issue of reproductive health care rights and justice been on the line, and this election is the opportunity for our voices to be heard, particularly women, particularly Black folks who have been far too long marginalized in the healthcare system. At Planned Parenthood affiliates across the country, our health centers are every day serving low-income people who are learning about their options, their choices. And honestly, this election matters because there are those who seek to take away people's choices in healthcare. So thank you to Derek Johnson, who is a close friend of our president at Planned Parenthood, Alexis McGill Johnson, freedom fighters together in the effort to make sure that we protect all of our rights. And this is absolutely one of the reasons why we need to not only fight because these are intersectional issues, right? We know that reproductive healthcare rights and justice is very much equally tied to voting rights. I'm sure we'll get into it into the conversation, but we know the same states that want to roll back access to reproductive health rights and justice want to control our other rights as well. And so it's extremely important. The NAACP is focused on this issue, and I'm looking forward to the conversation.
Thank you so much. Last but certainly not least, Ashanta Gleason.
Thank you, Dr. Wendy. My name is Ashanta Gleason. I'm a senior at Southern University in Baton Rouge, Louisiana, majoring in history with a minor in sociology. I also have the honor of serving as the Region 6 Youth Board member on the National Board of Directors for the NAACP, and the greatest honor of serving as Louisiana Youth and College State Conference President in the great state of Louisiana. And I'm so happy to be involved in this conversation tonight. Thank you.
Thank you so much. So let's jump right in. And this question is for all the panelists as we continue to, really just level set here as far as the importance of reproductive justice. What we know to be true is reproductive justice is not just about access to health care, but also deeply connected to racial and economic justice. How do you see these intersections playing out in the current political landscape, particularly for Black women and historically marginalized communities? We could start with you, Jacqueline.
Thank you so much. And sorry, I was slow to get off mute there. Slow to do that. But I definitely, again, want to commend the NAACP for having this conversation at such an important time, period, we know that, look at the current landscape. We have never been at a time where we have the majority of millennial voters, Gen Z, and other voters who are voting where their reproductive rights have been taken away, right? The Dobbs decision from a couple of years ago from the Supreme Court would seek to undermine Roe v. Wade and turn back the clock on the much needed access to freedoms, success, and people's ability to make decisions about their own bodies. And so we find ourselves in this unprecedented moment in time when the best way to make your voice heard is at the ballot box. One of the reasons why reproductive justice, even different across all communities, is so important is because it is a framework which asks us to think about not just the choice to have your child, but also the choice not to have children. And how is the healthcare system, how is the criminal justice system supporting us? In this moment in time, since we have seen Roe fall, we have seen more misinformation, more criminalization of Black and Brown people because of the choice to step away from protecting people's reproductive access. We know that this is deeply intertwined, obviously, with what you heard at the top of the call: LGBTQ rights, disability justice, immigrant justice. It is one of the many issues. But the thing to know about Black folks, right, is that oftentimes these lived experiences are happening to us all at once. And our communities can be both immigrants and have their access to repro health denied, and be from the LGBT community. And so it is important for us to think about the movements and issues, how these issues are going to be impacting people. With the upcoming election, obviously, we want to make sure that voters are educated and understand who stands with them, who does not stand with them, and more importantly, that there is a vision for where we want to go. Honestly, every politician right now should be talking about how to get people more access to healthcare, not less access to healthcare. And when we hear those who oppose abortion rights, who oppose in vitro fertilization and an opportunity for people to expand their families, we know that these folks are pushing positions that don't line up with where the vast majority of the public are. But what's going to be obviously most crucial to demonstrate that point is the ability to get out and vote and demonstrate, and just how far-reaching their views are versus the majority of people who want to be able to have families in safe environments, free from violence, and to be able to make sure that their children are able to get the education and opportunities like anyone else. And so that's what reproductive justice is about. That's why it's on the ballot this year, and why it's going to be so important that everybody, you leave this webinar and you talk about these issues to your friends and family, maybe who have decided or aren't decided yet if they're going to vote, because every single one of these votes will make a difference in people's future.
Thank you so much. Dr. Pernell, I would love to hear from you regarding this question.
Wow, there are so many places I could go with this question, but let me first start with a conversation that I was at earlier today. So I shared with all of you that I'm a public health and preventive medicine physician. And in addition to being director of our Center for Health Equity, I sit on the board for the American College of Preventive Medicine. And tonight in our conversation, we were talking about, in the United States, we are still fundamentally struggling with the issue of healthcare being a right. We have warmed up, if you will, to the understanding collectively that the right to purchase healthcare is the right that we're fighting for, and not the right to healthcare, right? So that's a distinction that I want everyone to understand, because when you live in a caste society, when you live in a white supremacist culture, when you live in a culture where systems of oppression are operating, like sexism, like racism, like genderism, like transphobia, Too often, privacy is a domain of those who are in positions of privilege in that caste. And those who are not in that position in caste, they don't have the right, so to say, from government's perspective, from law's perspective, from policy's perspective, to make decisions around their own bodies. And historically, we have grappled with this in health and healthcare, whether we're talking about Black women's bodies who were subjugated during slavery, Black women's bodies who were experimented on, Black women's bodies who were raped and oppressed. And whether we take that trajectory throughout this caste system, this caste culture that we live in, and begin to think about Mississippi appendectomies, if you will, right? Black women being forced into sterilization by the healthcare complex. And this trend, this trajectory does not just rest in the healthcare domain, but it is across multiple sectors in society and culture. But all of those sectors, all of those different pathways impact our health and well-being. Look, as a physician, I boldly say only 20% of the healthcare industry is only 20% of your health outcomes comes from the healthcare industry, meaning your doctor, meaning your hospital, right? Meaning the types of services that are available to you. It is an important part of that, but the rest of your health outcomes is shaped by what is happening in the community where you live. So those laws, whether at a state level or those laws at a federal level, they really do structure or determine how you receive care in the United States. They structure and determine your access to economic opportunity, which in turn impacts the decisions that you might make around your body, whether to parent or not to parent. So there is so much that is at play here. And in this season, at such a time as now, when we in public health are talking about civic health, making the connection between governance and healthcare outcomes, it is so fundamentally important that we elevate the lived experiences, the narratives, that we share the power back with those women who are most disproportionately impacted. And we'll get into it further tonight, hopefully, but whether you're talking about food deserts or maternity care deserts, right? We see Black women suffering disproportionately because they don't live in an ecosystem that prioritizes, values, or protects their ability to exercise their humanity. And a part of that ability to exercise that humanity is the decision around how you want to parent or if you want to parent and access to care.
Thank you so much, Dr. Pernell. Ashanti, I want to toss it over to you. I want to talk a little bit about the work Emerge has done in the past and how, Emerge has been focused on training women to run for office. How important is political representation, particularly of women of color, in shaping policies that protect reproductive rights? And what advice, if any, do you have for women who want to get involved in politics, but may be hesitant to do so?
Yes, absolutely. And we always have to start with just breaking this down and looking at how many elected offices there are in this country. And there are 520,000 elected offices in this country. So that is 520,000 people that get to shape our lives with a stroke of a pen. We know we're constantly hearing about the presidential race, who our vice presidential people are. Those are just 2 of those seats. When we look at Congress, that's just 535 of those seats. The rest of them are at the state and local level. So those are the people who are having the most direct impact on our lives. We keep hearing people say that how abortion decisions have gone back to the states, and they have. And right now, nearly 60% of Black women live in states where there is some sort of abortion ban. When we look at state legislatures, people who want to ban abortion outright, they have control of the majority of those state legislatures. So that is where we are at when we look at it from a perspective of who our elected officials are. When we break it down to Black women do not hold a majority of those seats. We are less than 10% of elected officials. despite the fact that we know abortion and all these other issues impact us heavily. So this is why we need to make sure that we are focusing on having that representation, having our lived experience at the table. When we are there, we legislate for everybody, for all communities. But we know when our voices aren't in the room, we are the ones who get disproportionately impacted. I'm really excited at Emerge that we have over 1,200 of our alums who are serving elected office across the country at all levels. This November, we have 500 of our alums who are on the ballot, and I'm proud that 61% of them are running for State House. And we have that focus on the new American majority at Emerge. So that's Black, Brown, and Indigenous women, women of color, young women, unmarried women, LGBTQ women, that intersectionality. Because pretty soon we're going to be the majority of the country. And at Emerge, we're preparing to make sure that we are putting our names on the ballot now and not waiting until we are the majority to run for office. We teach women how to run. We demystify the process, because I love that question. What does it take to run? You already have it in you. Everybody starts from somewhere. We're not all Beyonce. We don't all wake up like this. And that is what we do at Emerge. We help everyone. One of my favorite stories is the vice president talks about her very first race for DA, and she had to turn to her friends for help. And that's why we're really big on the network of support here at Emerge. It was her friends who helped her write her bio, who helped her put all of her contacts together, and a Palm Pilot, if anyone remembers those, that's what she used. And she says she put her ironing board in the backseat of her car, and she took that to grocery stores to campaign. We all have our journey, and we want for Black women to know that you're already enough. I am in rooms all the time with elected officials, male elected officials. I know Jacqueline is as well. You have what it takes to run for office. So many of these people go unopposed, and that is why they are in there. They're counting on us not running. They're counting on us not being involved. And for the women who are watching this, I just want for you to think about everything that you did today before you got here tonight. You took care of yourself. You probably took care of other people. You thought about finances. You're doing work for your community, probably a job. Those are the things that you do in elected office. And we need those people who care strongly about the community to serve. So I'm asking you to run for office. I will ask again throughout this program. I asked multiple times, but know that you have organizations like Emerge that are here to support. Planned Parenthood, they do endorsement and funding. There is a network for Black women to step up and run.
Thank you so much, Ashanti. I really enjoyed actually that think about what you did before you got here today. That's a very good point. Ashanta, I want to switch the gears and talk about young people. Young people are at the forefront of many social movements today. How do you see youth activism shaping the future of reproductive justice, and what does that look like?
Yes, I actually want to start off by saying I am honored to be a part of a generation like the generation that I'm part of. One, because we are creative. We breathe energy into every movement. And honestly, quite frankly, we are the movement. Any movement that we're part of, we become the movement. So I want to start off with saying that first before I get into it. But I will say that youth are at the forefront of most social justice movements. And when it comes to reproductive justice, we realize and have realized that youth have been utilizing social media. We have utilized grassroots organizing to mobilize and educate our peers. But one thing that I think that our generation now and youth prioritize is, if I know it, my friend needs to know it too. If I know it, my family is going to know it too. If I know it, my social media following is going to know it too. And that's the way that we have been taking charge and leading on the foreground of our movements and the movements that we have been reshaping. So when it comes to reproductive justice, young people today are redefining that movement in the ways of what it actually means, focusing on intersectionality, inclusivity, and how those things are, how reproductive justice is not the only issue. It starts the issue, but it's not what it will end at. We realize that if a woman is affected, a man will be affected, that cat, that dog is going to be affected, our child, everyone is going to be affected by reproductive justice. So we aren't only advocating for reproductive justice, but we're advocating for broader issues such as LGBTQ rights and how it intersects with reproductive justice, or economic inequality and how it intersects with reproductive justice, and healthcare access and how it intersects with those things. So we're demanding for inclusive policies, utilizing social media, utilizing our practices of grassroots organizing and organizing these movements in what I would say is a less traditional way, because we're utilizing TikTok, we're utilizing social media and Facebook, and we still use Facebook. We utilize Facebook and Instagram in any way that we can actually reach the crowd in a more holistic way, to make sure that our people or our peers are understanding what reproductive justice is, and that it's not only tied to Roe v. Wade, but it's tied to everything that could affect people of color or Black people, period, and us personally on a day-to-day. So that is exactly how we're redefining, by making sure that we're finding ourselves in the reproductive justice movement.
Thank you so much. Now I have a question for all of the panelists, so feel free to jump in. I know that something that has been a topic of conversation with the upcoming election has been that of Project 2025. And, with the looming threat of Project 2025 and the shift in balance of power in the Supreme Court, doubled with the recent attacks on Roe v. Wade, what are potential long-term impacts on reproductive rights that you would like to share with the audience? And how do we protect against further erosion of these rights at both the state and the federal level? And anyone can answer that.
Dr. Wendy, I'd like to jump in here first, if I may. Wow. When we look at Project 2025, it is an assault on humanity and an assault on health equity. Let's start there. I think it's important to define health equity in the most fulsome way. And in the words of Dr. Cameron Jones, a fellow Black woman physician scientist, she says that health equity is the assurance for the conditions to achieve optimal health for all people. Assurance. So assurance speaks to government's role in exercising its power or authority to create access, to create opportunity, to remove barriers so that people are not disproportionately burdened by stressors or disproportionately burdened by negative factors that lead to premature mortality or lessen the ability to have actualized lives or lessen the opportunity to receive safe, high-quality, socially and culturally fluent care. So I want to start there. Project 2025 is an assault on health equity. One of the most demonstrative ways that Project 2025 is an assault on health equity is the assault on reproductive justice. But that goes at the core of how do we define humanity in our nation. In Project 2025, it seeks to define a humanity that doesn't include many of us across this virtual table and many of our people, our sisters, our brothers, and those who are non-binary in the human family. And it's so important that we all understand that, because it goes back to that fundamental thing is who has rights? Which rights do people have? And how are people allowed to exercise or walk in their power? So what we've done in the NAACP is we want to not just talk about Project 2025, but we want to talk about our 2025. And we want to ensure that those in the Black community, in all historically marginalized communities especially, understand that we can speak truth to power and hold these systems accountable. And we can hold them accountable around things like reproductive justice, like access to health care, like the ability to exercise our vote. So in the center, we've been really helping to cultivate an awareness and an activation, if you will, around what drives healthy outcomes. So if people can understand that, they know how to exercise their power. And a lot of your health and your healthcare outcomes are rooted in the situations, the context, and the conditions of where you live, where you work, you pray, you play, and you age, right? So I used the term maternity care deserts earlier. And another one of the panelists spoke about Black women living in politically hostile, right, territories or geographic regions in the United States. If you marry those two things, that the majority of Black women and women of reproductive ages living in these states with very restrictive laws around healthcare, abortion is healthcare, okay? very restrictive laws around healthcare, you will also see that those communities also have food deserts. So not only are they lacking birth centers or lacking obstetricians and gynecologists, right, or lacking appropriate levels of insurance, they're lacking healthy and nutritious food. And I want people to understand that it's not just one thing, it's all of those things. That's why Project 2025 is an assault on health equity. And the last thing that I will say is that a policy, a belief system, which Project 2025 is, not only really impacts the person looking to have access to care, but it seeks to criminalize physicians, providers, nurse midwives, right? Others in the practitioner community around having the ability to deliver high quality, safe, affordable, and socially and culturally fluent care.
Thank you so much for that. Would anyone like to add to that question?
Yes, I would. And thank you so much, Doctor. And I want to look at it from a more political perspective, because when we think about Project 2025, we are saying, oh, this is something that's on the horizon. But we have to be honest that Project 2025 is already here. We are seeing it being enacted in so many states. What happened to Amber Thurman, Candy Miller, that is a result of Project 2025. So they already have their game plan that they've been doing for years, just picking at certain states about what issues they could get passed so they know how to be able to pass it at a national level. And we know they want to do it by executive order, which is another reason why who the president is matters a lot. So when we're looking at that federal level, if we want to make sure that we don't have a national abortion ban, we need to make sure that we're voting those people into Congress who actually care about protecting reproductive justice. When we're talking about it at the state level, again, that means making sure that we are electing those people who will protect the right. I talked about the 60% of where Black women live, but those 40%, they do live in states where they do have those great elected officials that they elected who take this so seriously. And abortion is on the ballot at the state level. There are so many people who have voted, will be voting to protect abortion in their state. So we have to think about that. And then I love how the doctor talked about how it is a health issue, but we also have to talk about how it is an economic issue as well. We are seeing more kids go into foster care. We're hearing horrible stories about kids being abandoned. That is an economic issue when people cannot afford to have children. It's also an education issue. You have college students who are determining what state they're going to go to school in based upon if they will have the right to have an abortion, if they unfortunately, experience a sexual assault. And that's why when you see abortion, economic issues, reproductive freedom, civic justice, gun violence, all of that on the ballot, we have to remind people all of that is tied together when we are talking about the ability to control your body.
Thank you so much for that. Jacqueline, I want to jump to you for a second. And if you could talk to us a little bit about what are some of the most immediate legislative threats to reproductive rights and how is Planned Parenthood mobilizing to counter them?
Thank you so much for the question. Certainly organizing around Project 2025, as you just heard our panelists discuss, is really important because we want to inform voters ahead of this election, less than 30 days to go. But what has also become really clear is that anti-abortion groups and anti-abortion politicians didn't stop at Dobbs, right? The Dobbs decision of a couple of years ago from the Supreme Court would roll back Roe v. Wade's protections of having access to abortion. But we've seen them go even further. Attacks on abortion access is not where they stopped. It is where they started. We've seen attacks in states on family planning and your ability to get birth control, LGBTQ rights, gender affirming care, in vitro fertilization. Just this week, actually, we saw Donald Trump's running mate, J.D. Vance, said if he were to be elected, they would make it their mission to defund Planned Parenthood health centers, where folks with very low incomes or no income or who rely on the Medicaid program for their health care would not be able to get access to a Planned Parenthood. So think about what this means. You have 1 in 4 women who have visited a Planned Parenthood at some point in their lifetime. Over 2 million people served annually, and more than half of the 50% of the patients are enrolled in federal and state programs like Medicaid or state programs that support their ability to get birth control, STI testing, cancer screenings, to be able to take control of their own health. And yet you have this election folks running who think the policy position they should be behind is to defund Planned Parenthood. But what it would really mean is that you're blocking access to people's ability to get access to healthcare programs, accessing critical care, helping them plan and space births, plan their families. It would be disastrous for public health. There's no other way to think about all safety net providers who are serving those who are the least of these, who have less access to resources. And it would also demonstrate, not just in the administration, but in the Congress, why it's so important to vote completely down the ballot, is because we know that a hostile United States House of Representatives would also continue to attack reproductive health rights and justice. We've seen them attempt to pass funding bills, attacks on birth control, the attacks on family planning for low-income people. And in the Senate, we've seen them continually go after the ability to obstruct the majority of the Senate to protect abortion access. So all of these efforts are about eroding reproductive freedom at an unprecedented time. We haven't seen this many attacks at all levels of government at all at one time ever before. And again, it's everything from your not just abortion access, it's your birth control, it's your ability to get your annual exam, it's IVF care for those who want to plan their families. And so this is very much a part of a longer term strategy. You heard Ashanti talk about the national abortion ban as a tactic, but they understand that they're going to continue to attack rights and try to take rights away. And that's why it's really important this November, we're calling on everybody to understand these policy positions are unpopular, but more importantly, they're dangerous for people's health care, particularly for lower income Black and Brown folks. And we shouldn't have politicians making these decisions. At the end of the day, people should be able to make the best healthcare decision for themselves in consultation with their doctors and control their lives, their bodies, their futures. And any politician who doesn't stand up and recognize that should not be someone that they are thinking about supporting, not just our current state, but our future and those who come after us. But we want to be able to make sure that this really shouldn't be a political issue. If you take it out of the hands of politicians, the majority of people understand that women need access to the care that they have decided upon in consultation with their doctors. That's not controversial, and it's not difficult to understand. What we really need is for politicians to be able to make less of these decisions for families.
Thank you so much, Jacqueline. I want to shift the conversation a little bit and talk about inclusivity and what that looks like around the notion of reproductive justice. We know that reproductive justice looks different across communities, especially those facing multiple forms of discrimination. How do we ensure that our reproductive justice efforts are inclusive of all communities, including the LGBTQ plus community, immigrants, and people with disabilities? And this can be to anyone, not directed to one individual.
I can start. Even before we found ourselves at this juncture, those of us in healthcare and public health, we've been talking about how do you drive cultural responsiveness in care? And just more broadly, I'd back it up and say, how do we create socially and culturally fluent spaces where people along the spectrum of humanity can show up in their full persons, their full selves? And too often when we talk about issues, whether we're talking about economic issues or political issues or health issues, we talk about them from the perspective in the larger and mainstream audience. We talk about them from the perspective of those who have power. What we can begin to do is to call that out, right? So in healthcare and in public health, we say where you see racism happening, call it out. Where you see sexism or genderism happening, call it out. Where you see transphobia happening, call it out, right? So that's one way of exercising and sharing power. And then the other way is shutting up and getting out of the way of those who have lived experience and narratives, who have been historically marginalized and excluded, right? And too often institutions, too often systems, too often majorities crowd out, silence, or fail to validate the ideas, the experiences, the truth and the realities of those who are not whatever the quote unquote norm is. We other people. So it's really important for those of us across our intersectionalities to recognize where our biases are, where our assumptions reside, where our power is, and then how do we coalesce and collaborate across movements and across sectors. So in the center, one of our pillars is healthy people, healthy communities, and health in all policies, right? You don't have to be in healthcare to be talking about public health or healthcare outcomes, right? You just need to be a human, and how your foundations of your community or setting impact your health and healthcare outcomes. And then the last two things I want to say is, one, I want to point to the link that I put in the chat, because a lot of the conversation that we just heard from the two previous panelists, where we're talking about our franchise, our ability to vote, voting disparities are tied to health disparities. And we are finally getting to the point where we're mapping out that information in public health. So I shared a link that I came across recently where you can look across the United States and see where people have self-reported better health or good health. Those are places where there are less encroachments on the franchise of voting, less gerrymandering and things of that nature, where people aren't able to exercise their ability or right to vote. And then the last thing that I would say is it's important for people to recognize that even though we're focusing on tonight reproductive justice and we're talking about reproductive health outcomes, we see a tying of all-cause mortality, tracking where we see worse outcomes from reproductive justice issues. We see a tying of maternal mortality, infant mortality. And so just again to emphasize the interrelation of those outcomes, and those happen across intersections of identity, whether you're a woman identifying or whether you're a person who is trans or whether you're a birthing or pregnant person. It is so important to understand the synchronicities of how white supremacist cultures, the synchronicities of how power is used to exclude and marginalize groups.
Thank you so much. In the interest of time, I see that, we have only 9 minutes left. I want to pose one more question to the panel, and it's sort of, to bring us all together and to have marching orders going forward. With the upcoming election, which is 26 days left, how can we better engage voters, particularly in communities of color, to prioritize reproductive rights when they head to the polls? I feel like there's so many different issues, but how do we ensure that people have at the top of their list that of reproductive rights? And I would love to hear from all of our panelists as we are closing this out.
I'll go first. So when we talk about engaging voters and making sure that they're prioritizing reproductive justice, well, even with any other topic, I think that we have to make sure that we're connecting these issues with people's everyday lives, that we're bringing in awareness to how these things could actually affect each person. I'll speak specifically for the youth, and I'll be the voice of the youth tonight and say that if we don't know, we won't do. So I wouldn't want to stand in front of a group of people and educate if I don't know exactly what I'm talking about. So I think one of the most important things that we have to hit on before even engaging with voters is educating voters and making sure that voters understand what reproductive justice is, how it could affect us, and just what it is, period, right? Because a lot of us don't understand what it is. I have peers who don't even know what reproductive justice, don't even know what Roe v. Wade is, and even though we think that it's common things for us to know, just basic understanding or basic webinars like these and offering opportunities and resources for people to be able to expand their knowledge on what it is, to be able to know that even though we're voting for mayor, that is going to still affect these things or whatever, it still ties into reproductive justice. So being able to make sure that people are educated is one of the major things that I think will be able to empower our voters and make sure that our voters are feeling like they're confident at the polls. Because one of the major things, and I'm researching myself too, one of the major things that I've learned about people that I've engaged with at my university or in universities around Louisiana is that, a lot of us are not willing to vote, but we're scared to vote because we don't want to vote the wrong way, or they think that it's the wrong way to vote. So if we're educating people and telling them how reproductive justice can affect people of color, low-income families, marginalized groups, and people like us and our peers, then I think that will be a great way to push people and influence them and motivate them to get to the polls instead of making it feel like they're being forced to because it's a major election. So making it kind of resonate with people will be a way that I think that will be the best thing. First, we educate them, we resonate with what's happening, a best way to be able to engage our voters in this upcoming election and elections beyond.
Thank you so much, Ashanta. Ashanti, would you like to jump in?
I will jump in because Ashanta said it so perfectly that this really isn't about parties. This is about policies, and it's about people and the policies that touch our lives every single day. And for women in particular, it's about knowing with confidence that if you have a reproductive health emergency, that you can get the health care that you need, that they can save your life because they won't have to worry about, is it going to cause them to lose their license or end up in jail? And women do not have that right now, especially Black women in particular. And as a vice president likes to say, that it is just immoral. And I've been seeing the men in the chat. Hello, thank you for joining us. This very much is about you too, because the women in your life, the women in the country, they do deserve the best healthcare possible. And by you educating yourself, educating other men, you get to help make that possible, because it will have a direct impact on you and your life as well. And if you don't really vote, then you kind of don't have a say in a lot of these things that are going to be happening. And to be honest, they are counting on us not voting, on us not having our say and making those decisions. So really knowing that it's about the policies and understanding your entire ballot, because there are so many elected offices that do have an impact on reproductive justice.
Thank you so much for that. Jacqueline?
Thank you so much. I want to say that I think Black women are consistently activists, and we are built for this moment, right? We are built for these times to push back against politicians who aren't fully answering our questions, to even have the opportunity to question politicians on their position, to make it clear that you're prioritizing reproductive health care in the upcoming election, and freedom for people to make their own decisions about their bodies. I think with our voices, with our votes, is how we make sure that politicians understand we want to be the one who gets to make decisions about our bodies and our lives, our futures. And I think if you look right at the role of activism and the even the civil rights movement and many other movements in the Black community, we have consistently led activism. We've been organizers. We have been politically engaged, from suffrage to civil rights and to the reproductive justice movement. We know that contributions of Black women cannot be overlooked. If anything, I would say as our reproductive justice partners, and the movement Sister Song frequently says, trust Black women, right? And I think if you want to understand how a particular race is going to impact your community, talking to those in the community who are most marginalized, maybe less connected to the political process, but they do understand the lived experience of how policies land on them and their lives and their families. And so I think one of the things that Planned Parenthood's Action Fund is doing this year is engaging particularly on HBCU homecoming tour, and making sure that we are going to some battleground states, be it Lincoln University in Pennsylvania, North Carolina, A&T, and Morehouse and Spelman in Atlanta, making sure that we're partnering with Greek organizations to do canvassing, to have people educated, to go door to door, making sure that we are helping get out the vote this year. And that activism led by Black women, I think, is how we prioritize this issue of reproductive justice next to all other issues, whether it be economic issues, work. And again, I have to shout out those in the reproductive justice movement, like groups like In Our Own Voices Action Fund, which has recently launched and dedicated time to educating women voters on the importance of Black women and reproductive justice. And so we're an example for the rest of America to show up. I think what Black women are going to be able to do this election is no short of amazing, because they're getting active, they're getting involved, using their power to fight for change. And it's important to both know the facts of what we're fighting for, but also then to move it into action. And so that's what I would encourage everybody to figure out your way and opportunity to move your beliefs into action this fall.
Thank you so much. And Dr. Pernell, do you want to close this out?
Sure. Everyone, what they said was brilliant. The only thing that I will add is what a student recently said to me after a talk I did. And he said, we need to talk about voting as a community action and not just an individual action, and to help people understand it through the lens of the pandemic. And, he got me at that. I'm a public health physician, so I'm leaning in. And he was like, where we were able to have breakthroughs and behaviors in the pandemic is when people fully understood wearing my mask doesn't necessarily protect me, but it protects the other person. Or getting vaccinated is not just about my well-being, but it's about collective or herd immunity. And so I'll end with this. Black women go and vote, right? We have been voting. We carry this mantle. We bear this cross. But we need to, in community, if you are in community with Black women, right? Or if you are sharing intersectional spaces with Black women, we need to understand your responsibility around that collective or community action of voting, and how your vote impacts someone who's been historically excluded or marginalized, or someone who has been disproportionately impacted. So I would really like for us to have communications or conversations in majority communities and with non-women or non-women identifying people to say, how does your vote impact those who have been most marginalized? I think I'll leave it there.
Thank you so much. And I believe, are we going to do a Q&A? If not.
Yes, we actually just have one question. What health awareness ongoing campaigns are we doing in our branches that can educate our communities? And I think that will go to you, Dr. Chris, in terms of NAACP, and then everyone else, if you all want to chime in on what your organizations are doing when it comes to health awareness.
Thank you. So the first thing I'm going to talk about is access to care. We just launched phase 2 of Hands Off Our Healthcare. Tomorrow night, this is the plug, we're having our monthly Health Leads Forum, where we're going to get on again and we're going to talk about how access to care, specifically Medicaid disenrollments, people being kicked off of Medicaid once pandemic protections expired, and how that has disproportionately impacted communities of color and children of color, okay? And so we have data that has been compiled that's publicly available on a state-by-state basis, and we're pushing that out to our units and branches so that we can mobilize around this information. And I said phase 2, so we've done this before publicly at the level of how does your governor score on his or her performance of protecting Medicaid. But now we want this part of the campaign to focus on how are we mobilizing people in community with this information. And so tomorrow night, we're going to talk about the Medicaid disenrollment campaign called Hands Off Our Healthcare. Otherwise, there are issues that we remain invested and involved around. Reproductive justice is but one, whether we're talking about mental health or whether we're talking about equitable access to food. During our most recent convention, one of our best attended advocacy forums was about eating well and living better. And so we want to talk about what is the access to healthy and affordable and nutritious foods. And again, I'm going to end by tying it to where there are maternity care deserts, and there are about 36% of counties in the United States are maternity care deserts. There are also food deserts. There are all other types of access deserts, right? There are quality education deserts. There are quality housing deserts. And so we want to continue to inform and to educate around these bedrock issues. And so you'll hear about more campaigns coming out of national. And please join us on our monthly Health Leads forums the second Thursday of every month.
Thank you so much for that, Dr. Chris. If you can, someone asked for the link. If it is open to the public, please share that link in the chat. Great. We have one more question. How can we get the attention of the youth? This is for ages between 20 and 40.
I'll jump in with one, but I'm really interested to hear from Ashanta. I want to hear your thoughts, but one idea this particular cycle you could do is to join Planned Parenthood votes on the road. We are doing I mentioned the homecoming tour in 3 cities, but also continuing to have what we refer to as shop talks. Shop talks are barbershops and hair salons. We are going to be focusing outreach programs, giving people a time not to be talked to, but to be listened to about what's important in this election and why they're voting, and encourage those who don't have a plan to make a plan to vote in Pennsylvania, Georgia, and Ohio, Akron and Cleveland, Ohio. And so if you're not connected to your local Planned Parenthood, but you're in those states, do look out for the Planned Parenthood votes actions that will be happening. And then just one quick plug for a reproductive justice partner in our own voice, Action Fund. They lead a Black women's reproductive justice agenda and are also going to be working to launch dedicated spaces for people to learn about the issues that are on the ballot and positions of federal and state candidates. So that is one organization that I would name, that if you don't know them because they're a smaller organization, really important voice in the way that they're hoping to educate particularly Black voters this cycle.
I'll go next. I think that a great way to be able to engage our youth, well, a couple great ways to be able to engage our youth. One is by opening opportunities for youth to be able to lead and be a part of things, whether that's like being an intern or being a part of a fellowship or even just shadowing the work or being a part of the work, period. Because I think that what's best for us is to be able to actually live in it ourselves or be a part of the actual or involved in the actual change. So even creating opportunities for you to be able to volunteer, lead on a project, or serve as like an ambassador for something, to be able to activate their sense of purpose throughout those movements. And another way, of course, is leveraging social media to be able to get our youth involved. So utilizing TikTok, that's where we are. But understanding first where people are to be able to meet them where they are is going to be really important. And youth are on social media, so we know we can catch them there. So being able to utilize platforms like TikTok, Twitter, Instagram, things to be able to interact with them by doing, whether it's live discussions on Instagram Live or interactive polls on Instagram or Reels or whatever, we'll be able to catch their attention to educate them or to get them involved will be useful and beneficial. And I also think too, when we have discussions like these, where I think that webinars are very, very important. I think that panel discussions are really important, but I think the factor that plays a role in actually engaging our youth and getting them to tap in completely is utilizing authentic messaging. Because we're able to read between the lines and see like if it's a politician coming to us just because they're trying to get our votes, or if it's somebody that's pushing their specific agenda to be able to get us to follow their lead or whatever. We know when it's real and we know when it's fake, and that's something I respect about our generation as well. But I think that when we get to these type of spaces and we get the youth to these type of spaces, we actually speak relatable language and speak actual lived experiences, because we gonna go through the same thing, but we have something in common at some point. We face the same challenges in different ways. So having discussions like these where we aren't using overly polished language, we aren't using overly polished content that we wouldn't really understand as youth, but being able to tell like those real life stories and testimonials and hosting conversations that youth can actually find themselves in. Again, I'm going to keep bringing up the word resonate. They can resonate with those. It makes us feel safer as youth to be able to be a part. It makes us feel confident because we know that, you know, we're experts in our own experiences too. So if we're able to relate with the experiences of the people that's teaching us or that's leading us or guiding us into the movement or guiding us into this type of work, we feel safe and way more confident to be able to put our best foot forward and be a part of it as well. So that is what I think will be the major key points of being able to influence and encourage our youth to be involved in things like these or in this type of work, period.
And I also wanted to hear from Ashanta. And from us with our work, it is those trusted messengers, those people who they look to for advice, who are going to keep it real, who are out there doing the work, really connecting them to them. I know there's been a lot of discussion this week about podcasts, and are podcasts effective? They really are. I have a podcast. My main age demographic is 20 to 45. And we are doing an entire season, our Project 2025, because our listeners requested it. They wanted that from me, and they wanted to hear from the people on the ground about how it is and how it will impact them. And we have an entire episode that is on reproductive justice and what is happening. So they're actually going to hear from those people who are doing the work. So really getting them connected to those people that they trust and know they're giving them real information and that they care about these issues.
Thank you so much. Are there any additional questions?
I believe we're good to close out.
Sounds good. I would just like to first of all thank our esteemed panelists for joining us here this evening. You've provided a wealth of information. We're also grateful, as well as resources. So make sure to look in the chat, as there were some links also provided for us to take with us as we leave this conversation. If nothing else, we want you all to walk away tonight knowing the importance of reproductive health care and how it is on the ballot, and how to put it on the forefront of your thinking, as not only you are headed to the polls, but as you're having conversations with others. My charge to everyone here is not just for you to vote in the next 26 days, but for you to take others to vote with you. We know that this is a very consequential election, one that will reverberate throughout not just our lifetime, but those generations after us. And because of that, I really want us to understand the importance of what lies ahead of us. So with that being said, make sure you vote, make sure you're aware of the importance of reproductive health care, and make sure you also pass along any resources or tools in which you may have and share them with other people as well. Thank you to the NAACP for having us. Thank you to all of the panelists. Thank you to all of the guests who joined us here this evening. And with that, I will pass it back over to our event organizer.
Thank you, Dr. Wendy. Thank you all so much for joining us. Can we please give our panel and our amazing moderator a round of applause for this amazing information? If you have not checked the chat, as Dr. Wendy has said, There is some information in the chat for us. There is our 2025 information on Project 2025 and what NAACP is doing in order to take action against it in terms of policy, as well as you have the Civic Engagement Toolkit. So it gives you talking points. It gives you the most top 5 issues that matter to Black individuals, the Black community when it comes to the upcoming election. Take a chance to look through it and look those resources to help us activate. We want to make sure that the words that we heard tonight are actually pushed through in policy and action, because we want to mobilize individuals to the polls and not just have not just have conversation. We want to ensure that we're educating individuals to act. Voting is an action, and we want to make sure that individuals are casting their vote. Thank you all so much for joining us tonight. We truly appreciate you. This information will be on naacp.org, so please go ahead and review it. And we also have an op-ed connected to reproductive justice written by none other than NCNW President Ms. Siobhan Arline Bradley. So we are truly thankful for that and hope that you all check it out. But thank you all so much and have a wonderful evening.
Thank you.